Thanks very much. Okay, so I'll keep my remarks in this very brief, but I'm really delighted to be here to introduce this session on behavior and social policy. And I think it's a nice segue from the session earlier this morning on One Health. My name's Lisa Boden. I'm a professor of population medicine and veterinary public health policy at the University of Edinburgh. I work and collaborate with Paul Diggard, who you'll be hearing from next. And my work is really based around contingency planning, communication, and coordination in response to global health and food security threats, both in the UK and Scotland, as part of a centre of expertise on animal disease outbreaks, and in countries which are fragile, such as Syria. So I'll move straight on, hopefully. We'll see. Into sort of the initial provocation for this session, which is a challenge, if you like, and it speaks a bit to what we were talking about this morning. This idea that there's still not the appropriate balance between the different scientific disciplines, in parentheses, when it comes to advice or evidence given to policymakers, meaning that understandably it's been dominated by the biomedical sciences and technocratic approaches when it comes to infectious diseases, and perhaps we perceive that the social sciences and the humanities have only a minor role, if any. So in other words, thinking about the humanities and social sciences as useful adjuncts rather than incorporating and embedding them at the outset in any policy planning or preparedness response. And I would say, I suppose, from a personal reflection, I probably should have said that my own background is also that linear, but I think of myself as an interdisciplinarian in that I started my life as a veterinarian and moved into veterinary public health and population medicine, and then into public health law and ethics. So the opportunities I think that this network offers is a chance really to think about a couple of key things, which I hope that the speakers will probably draw on in this session. First of all, the idea that we want to consider the social relationships in this One Health context between humans, animals, and the environment, and in particular, perhaps try to address some of the assumptions behind their capitalization, which might influence those deeper drivers or preconditions which made it possible for these emergent diseases and as essential threats. Secondly, I think that it's really important that we integrate different types of disciplinary expertise so we can better understand and shape perceptions of risk within a risk governance framework, both within and out with disease emergencies. So specifically thinking about how we can understand emotions, stress, individual and collective responses so that we can better align those, thinking about the motivations and characteristics and qualities of effective leadership, and how that feeds into decision making at sort of local, regional, and national scales, identifying and then implementing appropriate locally acceptable risk management strategies, which also take into account these sectoral, regional, and global differences, and then, as been mentioned already, integrating risk communication across the geographical, political, institutional, as well as different disciplinary domains. And lastly, I think there's a real opportunity to be self-reflective and critique our own work. So question the fixed ideas that we might have within this network related to society as it currently exists. So who gets to shape the knowledge, the protocols, and the responses to One Health emergencies, for example, within the network or out with the network? And more importantly, who could and who should in different contexts? And by doing so, we might be able to better incorporate principles of justice, equity, and ethics, and be more explicit about those in the kind of network that we're trying to shape here. Our session speakers, I'm delighted to say, in this session this morning, we have Professor Dirk Pfeiffer from the City University of Hong Kong and Professor Tony Barnett from the Royal Veterinary College. And then this afternoon, Dr. Helen Roberts from DEFRA, who's going to be joining Tony to talk about her views on the role of a multidisciplinary team in delivering science-based policy. I canvassed each of them really to try and understand what some kind of key themes and messages that we could expect. And I think they're going to challenge us in this session to really think about how we dissolve boundaries of expertise to, if you like, follow the problem when we're thinking about pandemic preparedness. Offer us some opportunities to clarify or perhaps be reflective about how we achieve clarity about the role and ethical responsibility of experts when we are trying to communicate and provide trusted but also timely scientific advice in the face of events which are characterized by uncertainty, sometimes complexity, and sometimes ambiguity. And then how we might think and recognize and integrate into policy decision-making pathways transferable skills from different disciplinary communities, and in particular, how we do that with local knowledge and experiences which may not fit our sort of, if you like, androcentric experiences from the global north. And then lastly, perhaps offer some self-reflection about the fragility of trust and the reputation of researchers amongst the general public, and how this relates to knowledge production and distribution. In other words, think about, for example, the positionality of the knowledge that we're producing and how that knowledge might be perceived by different audiences.